Hello and welcome. I'm Dr. Robert Singer, Director of Neurovascular Therapeutics in the section of neurosurgery at Dartmouth-Hitchcock Medical Center. It's our hope that the following information will be helpful to you in understanding your care. What is a brain aneurysm? A brain aneurysm, or cerebral aneurysm, is a weak bulging spot on the wall of a brain artery, very much like a thin balloon or weak spot on an inner tube. There are three basic types of aneurysms: fusiform aneurysms, where the entire blood vessel wall is dilated and abnormal; saccular or berry aneurysms, which are most common, where there's an outpouching on the side of a blood vessel, usually at a branch point; and mycotic aneurysms. Mycotic aneurysms are usually associated with an infection. There are a variety of locations for cerebral aneurysms. Most occur at an area called the Circle of Willis, which is a large networking area of arteries at the base of the brain. Again, most saccular aneurysms occur at branch points of blood vessels. In this slide, you can see the majority of the aneurysms that we see and their incidence. Cerebral aneurysms account for 5% of all strokes. We believe that there are about 10 to 15 million Americans that have them. 20 to 30% of patients who are diagnosed with cerebral aneurysms have multiple aneurysms. There are approximately 30,000 ruptures per year, and the mortality rate or death rate from the rupture of an aneurysm is very high at 45%. There are certain risk factors that contribute to the formation of brain aneurysms. Some of them include smoking, high blood pressure, congenital abnormalities, a family history of brain aneurysms, age over 40, women compared to men have an increased incidence of aneurysms, other disorders such as Ehlers-Danlos, polycystic kidney disease, Marfan syndrome, and fibromuscular dysplasia. The presence of an AVM, or arteriovenous malformation, can contribute to aneurysm formation, as can cocaine use, infection, tumors, and head injury. Risk factors that contribute to the rupture of a brain aneurysm include smoking and high blood pressure or hypertension. Fortunately, both of these can usually be treated with medical management and personal decision. When deciding to treat a brain aneurysm, there are many factors to consider. Those include the risk of hemorrhage, which is oftentimes associated with the size and sometimes the location of the aneurysm. Age and health of the patient is important to consider when making a decision about an operation. A family history and family impact of brain aneurysms often is factored in when deciding to pursue treatment. Also, from a surgeon's perspective, those risks associated with the proposed treatment are taken into consideration, and most importantly, patient preference